All right, so we've already learned about the stethoscope, right? Everybody's good with that, parts of the stethoscope. Let's look at the cuff. Did y'all catch the name of the cuff?
Big long word.
It is a very long word.
It's right here.
Sphygmomanometer. Okay, say sphygmomanometer. Sphygmomanometer. If you spell, if you say it just like it's spelled, minus the PH that says the F sound, you'll say it correctly. It's pretty well phonetic. Just that PH. So let's look at the cuff. Everybody's got one. So a few things to look at while we're going through here. One is that this writing and like where you hang your dial, which we'll go on here, this always goes on the outside. So I'll tell you another clue. If you put this, I'll show you what it's going to do. If you put this inside out, okay, and that happens sometimes like this, okay, you put it inside out. Let me show you what's going to happen. So if this happens to you, you'll know why. And it'll pop off. Okay, that's that. It didn't really happen very forcefully. Sometimes it happens. Okay, so if that happens and you notice you're like, okay, I'm pumping this up, but it's not putting any pressure, and it looks like it's about to pop off, that means you have it inside out. So you need to just take it off and put it back on. Okay, so that's that. Now, the artery, there should be a spot on yours, on all of them, that says where, like, it points to an artery. That says where it should go. It should be right down by the Velcro, the rough Velcro part. Maybe underneath did y'all have the red ones? Don't have it? Yeah, they do, and that's black. This little black square on there. See where it has an arrow and artery pointing to that? Okay, that's another clue that you've got it on the right way. You should be able to read that whenever you're putting this on their arm. Okay, now what that means is that it's supposed to go with the brachial artery. So you'll see if you can find your brachial artery or brachial pulse. Okay, it's usually on the inside, kind of towards your funny bone. Okay, and you should be able to find it right at the bend of your elbow, but it's usually more on the inside. And then the straighter your arm is, the easier it is to find. So kind of on the inside, right at the bend. Did y'all find it? Find yours? Got it? Not yet. Usually. Some people's is more medial than others. I had trouble finding one this morning. There it is right there. Find it? Okay. So that's what you're looking for. Now, you're not going to have to take their pulse necessarily to do their blood pressure, but you do want to find it. And we'll talk about why in a little bit. But where that artery is and where you felt that's kind of where you're wanting to put this arrow on their arm. Okay? So we're going to take blood pressures on the arm using the brachial artery. And it's kind of hard to put it on yourself. I'm just putting it on myself to show you. These tubes go down towards their hand. Okay? And there's lots of tubes going on. So the tubes, I think the more practice you get, the better you get at it, because between these two tubes and the tubing on your stethoscope, there's lots of tubes going on, and they kind of get all over the place. So don't get, it just takes practice to get comfortable. It's kind of awkward at first because you're trying to figure out where to put your hands and how do you hold everything, all that. So anyway, so whenever you put this cup on someone's arm, okay, that should be lined up about where, it doesn't have to be exact, that artery, but it should be, usually it's going to be kind of on the inside. And you want to make sure that the cuff is high enough above their antecubital space, this bend in their elbow, that you're not going to have to touch it when you go to put your stethoscope on there. Okay, if they're touching, what's going to happen is you're going to get a lot of noise from the air in here into your stethoscope, and then you're going to have a hard time hearing the actual blood pressure. Okay. So once that goes on, you put it on. You don't need to necessarily put it on real tight. It just needs to be on tight enough that it's not like sliding all up and down the arm. Okay, it doesn't have to be really, you know, you don't want to be already cutting up the circulation. Okay, so that's that. Getting twisted here. So this dial you can do a couple of things with it. It has if you'll look at it, it has like a clip on the back, and it also has these two hooks. So you can either hook the dial up to the very top of the cuff with those using the hooks, or you can clip it in underneath, kind of underneath that little loop, if you will. I usually just clip mine on the top because I don't know if I'm going to use their right arm or their left arm, and I don't want to. Ooh, that's not correct on my other class. And I don't want to. Yeah, I like to be able to move mine around if I need to. Now, a few things as far as the procedure goes, taking a blood pressure. There's a few times you need to be choosy about your arm. Usually it doesn't matter which arm you take a blood pressure in. But if they had like an IV in one arm, you wouldn't want to use that arm because you might obliterate it and, you know, mess up their IV. If they have a shunt, like if they're on dialysis or something, sometimes they'll have a shunt dialysis shunt in their arm. That would be another reason you would definitely not want to do that because you could injure that and they need that to be able to have dialysis. So you don't want to do that. So if they have any kind of, you know, they've had any surgery, obviously, injury, if they have a shunt or an IV, you wouldn't want to do that. If they've had a mastectomy, that's another reason. Usually whenever they do a mastectomy, there's a lot more than just breast tissue that they remove. They remove a lot of it under the arm, too. And so that would be another reason you would want to do blood pressure on one arm or another. But normally it doesn't matter. Okay? A couple other things they make different sizes of cuffs. This is kind of your standard adult cuff. They do make them bigger, and depending on size of the person, you know, it can alter your results of what their blood pressure really is.
Teachers, for this interruption, at this time, I need all high school track members to please be released.
So, anyway, so we will. Oh yeah, so we're going to, for everybody in here, we're going to use, obviously, this. They do make big ones. If you have a cuff that's too big, it can make the blood pressure seem lower than what it actually is. Or if you use a blood pressure cuff that's too small, it can make the blood pressure seem higher than what it actually is. And now babies, I mean, they even make them for babies, and they'll be like this big. They'll give you blood pressure. Okay, good luck, children. So, a few things. We are going to practice a few more things about the cuff itself. Okay, this is your dial. This is an aneroid sphygmomanometer that has this dial with the face with the numbers on it. I'm going to give you guys one assignment. You won't get to this today probably, but I'm going to leave this here and you guys can work on it tomorrow.
Teachers and students, please remember this announcement. At this time, all high school track participants, please release them. If you would at this time, all track participants, please report to your area. Thank you.
Okay. This is just all this is this worksheet is just a picture of what's on this dial. And I just want y'all to be able to practice looking at it, because what happens is whenever you're actually taking the blood pressure, I mean, you only have a split second to look at the number, determine what it is, and kind of get it in your head. So this is just practice on reading it is all. So if you'll notice on here, your larger increments, okay, those larger lines, those are all tens places. And then the smaller lines are twos. Okay, so what number one obviously is 20, it's 20 to 20. millimeters of mercury. Number 2 then would be what? What is it pointed at? 34. Okay, everybody see one? So 30 is the longer line, and then you got your smaller lines, 32 and then 34. So that's just practice and go all the way around. Most of the time, numbers you'll be using are like in the mid hundreds, and then like the 60, to 80, 90. Anyway, so you guys can work on that tomorrow. Go ahead and give it to you. This is just, the more practice you get, the better, the easier it is to look at the dial and determine what their blood pressure is. All right, so that's the dial, and you can look at the dial on here, and it's the same thing. The longer lines are your 10s, like 20, 30, 40, 50, and then the shorter lines are your 2s. Sometimes it's kind of hard to tell, but as far as like our testing goes, as long as you're within 5 millimeters of mercury above or below, that's fine. That's fine as far as our testing purposes go. Okay, so that's the dial. That's where you're actually going to read the numbers, find the numbers for your systolic and your diastolic, and then you have the bulb. Okay, this part is the valve, this part that turns right here, and then this is the bulb or the pump, whatever you want to call it. Okay, so a couple things I want you to notice about this part is if you'll hold it like this, actually, I'm sorry, hold it like this. No, you don't have to hold your cup like this. I'm just trying to hold it. Turn it to where, there you go. And you can hold it that way. Oh yeah, you are holding it that way. Sorry. I hold mine the opposite of what you're supposed to. I think I have like these really long monkey fingers. I don't know. I have a hard time holding things sometimes because they're so long. I don't know what to do with them. So, anyways, I'm turning mine around again. So it's the same as any other. Like if you're screwing something into the wall, it's righty tighty, lefty loosey. So right, turning it right closes the valve. Turning it left opens it. So let's just practice opening and closing the valve for a second. You can put your cup on your arm, probably your non-dominant arm. And I teach this blood pressure like this every year just to get you used to opening and closing that valve and letting the air out really slow. Oh gosh. Yeah, the tubing always goes towards your hand. So yeah, y'all are doing good. You're doing good. Just put it on your forearm for now if you want to, and it'll make it a little easier just to. It doesn't really matter. It's just you're just going to practice pumping it up. We're not going to actually read a blood pressure right now.
Oh gosh, I'm like helpless.
I know. I can't do anything with my left hand, so. And you might take your dial off so you can kind of read it and look at it. Just leave it on your desk if you want to. Okay, so again, turning it right tightens it up. So start pumping with the turn to the right. Okay, now let's get in pressure. Okay, so now let it out all the way to the left. Now I'll try pumping it and see what it does. You hear how you can still hear the air coming out? Okay, if you start doing that while you're taking somebody's blood pressure, that's a clue that you haven't tightened up your valve. So tighten it back up and then you can pump it up again and you'll be able to tell. Okay. Mine is. Do it. Turn it the other way. There you go. Yeah, that is that's one thing. If you turn these real hard either way, one way or another, like here, okay, then it will get stuck. And so what happens is, like, watch if I turn this too hard and I get my pressure up, and I want this to go really slow, but if I get it stuck like I did, and then I try to open it, it's going to let all my air out so fast I'm not going to be able to read my numbers. So you want it to let air out really slow. So whenever you're turning this valve, you only have to turn it until it stops, and then you don't have to like tighten it or anything. Just turn it until it stops, and then be done at that. Okay. So here's what I want us to do next. Now that your arms are all tired and get your feeling back in your fingers, I want you to pump it up until, let's just say like 120, 130. And then I want you to turn the valve really slow and practice letting air out really slowly. And you can go higher than that if you need to.
So then,
You have it turned the right way? There you go. Righty-tighty, lefty-loosey.
there we go.
And I'll show you. To show you on. Okay, let me show you on here. Well, you can see it. Okay, that didn't work, did it? Oh, there we go. I'll show you about how fast you want to. Oh, that's too fast. Not like that. It's about how slow you want it to go. You don't want it to go so slow that they're miserable and they're like, get this off my arm. But you want to go slow enough that you can see the numbers. And then yelling a little bit more at the bottom. It gets coming. Okay. So that's about how fast. So do that. Let's do that a couple of times. Just pump it up and then let it back out kind of slow. All right. Feel pretty good about it? I hold it out slow enough? Okay. So now I'm going to teach you what you're actually trying to listen for. This way so they can see the screen. Okay, I know it's kind of hard to see because it's like, I don't know, some glary or something. Okay, so what are the two blood pressures that we look for? Systolic and diastolic. A little bit better, maybe? Better. There we go. Oh no. Yes, systolic and diastolic. Systolic is where? Well, where is it on the fraction that you're looking at? It's on the top. It's the higher number. Okay. So here's what's going to happen. So when you put your blood pressure cuff on their arm, one thing that you're going to want to do, actually, do y'all have your skills check sheet, your vital signs skills check sheet? It goes through here in case you forget tomorrow whenever you go to practice. Step by step, it goes in here exactly what to do while you're taking a blood pressure. And some of this we've already talked about. So vital signs skills check paper. Okay. Number 16 is where the blood pressure starts. So explains the blood pressure procedure to the patient. You just tell them that you're going to be taking their blood pressure. It's going to squeeze their arm. It'll only last a few seconds. Okay, number 17, assist them into a comfortable sitting position. You want them with their arm, palm up. They do need to be sitting down whenever you do this. Rolls their sleeve up about 5 inches above the elbow, if you can. Now, if they have on a sweatshirt, you're not going to be able to hear blood pressure through a sweatshirt. If they have on like a thin, long sleeve shirt, you can usually hear without an issue. But other than that, they have on a, t-shirt or whatever. Just roll it up, and you want it above the elbow. Of course, you guys are going to clean your stethoscopes. Make sure you locate the brachial artery, like we just said. Okay, so you're going to locate their brachial artery. You don't have to check a pulse. Okay, you don't have to count it or anything. You just want to locate it, figure out where it is, because that's where you're going to put the head of your stethoscope. The diaphragm of your stethoscope is going to go right over the spot where you felt that pulse, because that's where you're going to be able to hear it the best. Okay, so you'll find that, put the blood pressure cuff up over their arm, apply it smoothly and snugly. You found the brachial artery, so you're going to put the head of your stethoscope directly over that spot. Tighten the, turn your valve so that it's closed, and pump it up. And so here's how you're going to determine how to pump it up. Okay, I'm going to let this, you guys should be able to hear this. This one plays music. Whoops, if I didn't turn it on. Hold on. I forgot to turn it on the first time. This is just a blood pressure arm to practice on. Okay, so you start to hear their pulse. Still hearing it. Okay, I quit hearing it way up here. See how it stopped? So I'm going to pump up about 30 more millimeters of mercury above that. And then I'm going to let my air out real slow, like we just learned. Okay, so you could hear what sounded like a pulse or a heartbeat, okay, and that's what you'll hear. Now, what you're trying to take note of is as you hear the sounds, okay, the very first sound that you hear, that's their systolic blood pressure. So with the very first beating that you hear, that's it. So like it was like 180, okay, is where it started. Okay, the very last sound that you hear is their diastolic blood pressure. And it was, I forgot, it was like 80, wasn't it? Not 80. Somewhere in there, 78, 80. Okay, so that's what you're listening for. Now, it doesn't sound all that perfect, on people. Sometimes it's hard to hear. You got background noise. If you get your stethoscope touching their blood pressure cuff, you're going to hear noise from that, and it makes it kind of hard. But that's what you're doing. Okay, that's what you're listening for, are those sounds. Now, a couple other things to consider. One is that you don't take the blood pressure going up. I only I only listen for those sounds going up, so I'd know how far I needed to pump. Okay, so once I hear that last sound on its way up, I'm going to pump up about 30 more millimeters of mercury, and then let it go. I take the blood pressure itself when it's coming back down. Okay, now for me, when I'm doing blood pressure, I usually pump it up to about 150, 160 if it's on just anybody that I don't know that they don't have a history of hypertension or anything like that. I just usually pump it up to about 150, 160 and take it. But if I get up there and I'm still hearing it, then I'll kind of use this method. I'll keep pumping until I don't hear it anymore, and then I'll pump up even higher than that and let it go back down. But that's when you listen for the sound is on its way back down. Okay. So that's that. Sometimes you'll have you'll notice the sounds kind of changed in there, and sometimes that happens. And that's not really anything to worry about. You're still going to do the sounds that you hear, first sound and the last sound. Now, sometimes you'll take blood pressure and it'll go from being like a beat, boom, boom, to being like a little puff of air. You don't count those. You just count the sounds. Okay, and the sounds that you hear. Now, the other thing that sometimes will throw you off is whenever you're doing this on an actual person, it doesn't do this on my electronic arm. But whenever you're taking blood pressure on an actual person, oftentimes it will tick. You'll see as the needle's going around, it'll tick. You might have noticed that even whenever you had it on your arm a while ago. Okay, the ticks usually happen at the same time as the beat. So it's good, you can use the ticks to kind of corner in your sound, like whenever you hear that first sound and it ticks right there, you can kind of take note of that number, but it will keep ticking long after you quit hearing the sound. So you can't just use the ticks to be your blood pressure. It's all about the sound. You have to hear it. Okay, does that make sense? Just trying to think of anything else. Normal blood pressure, you know, anywhere from 60, from I'd say 95, 100 to 130, 140. Usually if it's anything over 135, at least consecutively, they're going to consider it hypertension. That's just for the systolic blood pressure. Now sometimes, I know the book said 100 to 140, but sometimes people have regular blood pressure. It might be lower than that. And that's okay too, as long as that's their norm. But some people, they get down to the 90s over 60s, and it's going to make them feel really bad. I mean, they're going to be like sluggish and don't want to get up and do anything and really tired because that's too low for them. It depends on the person. Okay, let's practice a couple more on here. And you guys can, we'll see where we hear the numbers and we'll practice doing that. Let's see. Now this, I do want you guys to practice on this machine some, because this is what I'll use to test you. Okay. All right, let's see if we can figure this one out. Thing. 128 over 70. Good. 128. I think I had 126 over 68 is what I put in, so good. I think the harder one to pick out is the bottom number whenever you hear it on, because it gets kind of faint. Sometimes it's hard to catch it, and it just takes practice. This whole thing takes practice, and so it's going to take you, several tries to really get it. So don't get frustrated with it, or couple things like trial and error, or not trial and error. What's the word I'm thinking of? Troubleshooting. I guess that's the word I'm thinking of. Is if you can't hear. First of all, whenever you first put that cuff on their arm and you go to listen, you're not going to hear anything because you only hear it when there's pressure. Okay, so you're not going to hear anything. I always have people say, they're like, I can't hear anything. Well, you're not going to hear it until you get that pressure in there. That's why you want to check your brachial artery pulse and see where it is so you know that you have your stethoscope in the right spot. So that's one thing. If you're still not hearing anything, make sure that your stethoscope is closed and not open. That'll make it where you don't hear. Make sure that you've got, it helps if they have their arm completely as straight as it'll be, because you want a good seal between the diaphragm right here and their arm. And so, you want to make sure that you have a really good seal. Otherwise, if you hold it like this, you're going to get a lot of outside noise in there. It's really hard to hear. Some people's is harder to hear than others. It just is. Guess that's it. I'm going to take one of y'all's blood pressure and I'll kind of show you what it looks like.